You've had a baby, you're healing, you're currently learning about how to keep a human baby alive. But who is looking after you? What is the care that is available for you? Well, in this video, I want to talk about what guidance says that women should be having for postnatal care in the UK. This is so that you know what's missing, what to demand, and what to make use of to make sure that you're getting the best out of your postnatal recovery. I'm Remi, I'm a doctor in obstetrics and gynaecology, and I'm building Her Health Room, a space to empower women and educate women so that they can recover fully after having a baby. On this channel, I'll be sharing videos and topics that cover the span of what I've just mentioned, and I want you involved. So subscribe to this channel, comment down below, and let me know what parts of life after baby you're struggling with. In this video, I'm going to break down, according to timeline, what care that you're entitled to from the NHS, how to make the most out of it, and how to start the process of postnatal recovery. And why is it important? Because once you know the steps to recovery, you can empower yourself, work with your midwife, work with your doctor to make sure that you're getting the most out of it. I share stories on this channel on occasion, and the stories I share are not from any one particular person, but from years of working on the shop floor. So today I'm going to tell you a story about Ruby. So Ruby had a vaginal delivery and unfortunately lost quite a bit of blood. I've got a video on postpartum hemorrhage on this channel, so go and check it out. So for argument's sake, she lost about 850 mils of blood, which is on the higher side for someone who's had a vaginal delivery. And she would have had her bloods checked, and the first set of bloods didn't show anything significant, and she went home. Whilst at home, she just felt rough. She felt tired. She didn't feel like herself. So I had a look at her. I had a look at her blood pressure, her heart rate, and everything at that point looked okay. And I said, you know what? Let's just do one more blood test, because that first blood test 6 hours after delivery won't always give you a clear picture of what's going on. So for this lady, her blood test on the second occasion was on the lower side. Not low enough to need a blood transfusion, but low enough to be considered for an iron infusion. And the way an iron infusion works is it goes through the drip, and over a period of time, it helps with the production of your red cells by providing iron, which is a very necessary material for red blood cells to be developed. Following her iron infusion, she's discharged home and encouraged to carry on with iron tablets for at least 3 months so that her stores really go back to normal. So this is an example of someone who's gone home, made it home, but had to come back because things weren't quite right. And that's an example of how the NHS can provide postnatal care, especially in emergencies, for women who've just had babies. But what are the other things? So in the first 24 hours after delivery, you are ideally checked over by a midwife or a doctor, depending on the type of delivery you had, depending on if there were any complications. And when they're looking at you, what they want to do is, are you still bleeding? Are you bleeding heavily? So that would involve assessing the tummy. Is the womb below the belly button? Because that's what we want, that the womb to contract down slowly, but it needs to be below the belly button, which tells us that yes, it's doing the things that it needs to be doing. Having a look at the pad. Is the pad heavy? Are there big blood clots on the pad? Are you changing the pad really often? And that again gives us a sign of whether or not your recovery is in the right direction. Other things I want to keep an eye out for: your blood pressure, but also the wound. The cesarean section wound, or if you've had a wound in the perineum, are they healing well? Are they showing any early signs of breakdown? They'll also want to know how you're deciding to feed the baby, breastfeeding or bottle feeding, and making sure that you're being supported through this. And even within those first 24 hours, it's really crucial that your emotional well-being is also assessed, because some women will have had a history of conditions like depression, anxiety, and even within the first 24 hours, those could get worse. If it's felt that all is well with you and baby at this point, then you could be discharged home. And that sums up your first 24 hours. In the UK, in areas in which I've worked, routinely you will then get checked at days 1, day 5 and day 10 after having a delivery. That's typically by the midwife, but you will also have some input by the healthcare visitor, and your GP is always available to assess you and the baby after the delivery, as well as options of the emergency services, either maternity triage or emergency services for the baby. You would ideally go under, according to the guidance, a named midwife, or I think in practice, a group of midwives. And again, what they're doing on those 10 days or 14 days after you've been discharged is checking your blood pressure, checking your urine, checking how you're feeding, checking your blood loss, checking the wound, your emotional state, and also checking to make sure that you are safe at home. These are the things that they'll be checking, as well as the baby. Is the baby feeding well? Is the baby putting on weight? And doing necessary checks for the baby. If it's felt that there are issues that need addressing, you are either escalated to the emergency services or the midwife might keep you on their books. So for instance, like I said, women who've had depression, anxiety, or any other issues in pregnancy or before pregnancy may often be looked after by specialist midwives who deal with emotional well-being and might want to see women way longer than the 10 or 14 days that I've indicated here, and that would already be planned antenatally. But if during the checkups they're like, actually you might need some further support, or you feel you need further support, it could be worth speaking to your midwife to see if there's an extension of that time where they're looking after you. After that, you've got the 6-week check. And as someone who's had 2 babies before and has engaged in a 6-week check before, I know that it's variable. But I'm here to tell you that it really needs to be led by you. So when you've had a delivery, you get paperwork that does go to the GP, does go to the community midwife. So they are aware of the issues that came up during your delivery. However, so are you. And I want to empower you to use that information to make sure that you are directing how your 6-week check goes about. So for instance, after my first baby, I lost about a litre of blood at the time of delivery. When I went home, my blood count was on the lower side. I did go home with iron tablets, but I wasn't, in typical doctor fashion, great about using them. And in my head, I was like, you know what, once I'm 6 weeks, I'll just go to the GP and get them to repeat the blood test. So when I went to the GP, unfortunately, my GP wasn't really aware, didn't volunteer a blood test. So I was like, excuse me, this is what happened to me, and therefore I want a blood test. And that was organised. And I say that to say, if you've had anything, high blood pressure, diabetes, lost a lot of blood, or you just don't feel well, it's useful to make sure that you express that to the GP so that they can arrange things to optimize care for you as well. And I think a really good tip is when you're booking that 6-week appointment, booking a double slot, because the baby needs an appointment, but so do you. And if you can take up 2 slots, then it means that the GP has enough time to examine you, assess you, and do all the things that are needed for you, and then have plenty of time to do the same things for baby. Also at that appointment, it would be worth noting that not only your physical symptoms are being assessed, but your emotional symptoms, your mental health, discussing things like contraception. So again, in guidance, in good practice, contraception is discussed all through pregnancy. If it can be done at the time of discharge, again, it should be done. But lots of women want time to think about it, right? And that 6-week check is a really good time to think about it, talk about it, because at that point, most contraceptions are suitable for use. 6 weeks might feel a bit early, but it's also a really good idea to start thinking about your future health. And if you don't feel like you're at the space where you're going to do it at 6 weeks, that's fine. You can always go back and see your GP at another point. If there are changes in medication, maybe it's found that you need to carry on medication that you've been taking during the pregnancy, again, there's always scope to book a follow-up appointment and see how you progress and get on with that. So in summary, you've got your first 24 hours, you've kind of got the first 2 weeks, and then you've got your 6-week check. And at any point between that, you can make an appointment to your GP, you can make use of emergency services, and I'm sure you can contact your midwife. But that's, in a nutshell, what you should expect under the UK guidance of postnatal care. Following that, it will be self-directed. There will be no prompts or chasing, and it really will be left for you to check in. I think longer term, there are things like pelvic floor, pain or not able to enjoy sex, mood, risk of diabetes and high blood pressure. And you've still got your GP for those things, but they do need to be self-directed. So if you found that you're having symptoms of incontinence, then it will be going back to your GP and initiating referral, either to a doctor or to a physiotherapist, so that your longer term health is being looked after. And these are the things that I'm hoping the videos on this channel will guide you towards. Knowing what is there, what is available, but knowing how you can empower yourself to get more from the system during your recovery period. So according to the guidance, quality care should be personalised. It should take your delivery into account. It should take your medical history into account. It should be planned. Ideally in pregnancy, it should be holistic. It should encompass your physical recovery, emotional recovery, and social support as well. And there are things available for social support, and I'll do another video on that. It should be coordinated. You should know who's leading your care. The guidance says about having a named midwife or a named doctor, which is all great, but sometimes even within that, they would work within a team. Knowing who to contact, where to go is really crucial for you so that you know that you have a softer landing spot. I'm not sat here to say that the system is perfect. In fact, I'm sat here because the system is in fact not perfect. And I want you to know that although these things exist, there are shortfalls, there are gaps, and actually you knowing what could be better or could be done to empower you can make you use better use of the system and better use of your clinicians. So hope you've enjoyed this video. I hope you've learned something from it. How was your postnatal period? What did you find was most useful? Did you find use from the 6-week check? And if you did, drop some comments below to encourage other women who are watching these videos how to make use of the appointments that they have with their clinicians. Otherwise, subscribe to this channel. I'd love to have you here. Tell me what you want. I want to make a space that really focuses on the holistic recovery of women after delivery, and I want to make sure that it really is impactful. Until next time.